Hello everyone. So one of the follower, well known, Dr. Shaunak Khandwala has asked a question, what is the treatment for refractory endometrium? So first of all, we have to understand whenever we are doing any infertility treatment, proper endometrium lining are very important for a success of that fertility treatment. So what is the proper endometrium lining? Any endometrium which is a good flow and which is from 8 to 12 is the optimum endometrium. And any endometrium which is less than 7 mm and not responding to any treatment is a thin refractory endometrium. So many a time we come across such thing during the course of the fertility treatment. And whenever we have a refractory thin endometrium, first of all, we should rule out the chronic endometritis or Asherman syndrome by doing a hysteroscopy and taking a biopsy and then sending it for infections and such things. So if we have ruled out all the infections and we have treated, and yet in spite of all the treatment like increasing the estrogen, giving some sildenafil and giving low dose aspirin, these are the treatment we give. And sometimes if during the course of the cycle, if the endometrium is thin, maybe the doctor has given overdose of clomiphene citrate or overdose of GnRH agonist. So this here we can change the protocol. If some doctor has used clomiphene citrate and the patient is having thin endometrium, use letrozole, use other agents. If that was a GnRH agonist cycle, so either they decrease the dose of GnRH agonist or change to another protocol. GnRH antagonist protocol you can change. But sometimes what happens? You have tried everything and it's not working. These are the conditions of thin refractory endometrium where we can use PRP sometime or we can use GCSF. But if it does not, response to even this, so in the last we can use the stem cell therapy, which has come recently as a treatment for refractory thin endometrium. So the patient can we can harvest the bone marrow, from the bone marrow, the stem cell, and the autologous stem cell from the bone marrow can be prepared in the lab and can be injected inside the uterine cavity. Sometimes when the normal PRP that we inject inside the uterine cavity doesn't work, so here we can inject the subendometrial PRP also. So these are the only two conditions. But sometimes when nothing works, the patient has to go for adoption in the last when nothing works. And if endometrium doesn't work, endometrium is not growing, so we cannot do anything in fertility. So that is a very frustrating thing. But many times the endometrium will respond to the treatment which I have just said. So thank you very much for the watching. Keep watching. We have many educational videos for you in the line.